This article by Derderian and colleagues discusses a drug safety communication put out by the FDA in December of 2016. Specifically, that communication states that, quote, repeated or lengthy use of general anesthetic and sedation drugs during surgeries or procedures in children younger than 3 years of age or in pregnant women during their third trimester may affect the development of children's brains. Specifically, they refer to a higher than normal incidence of learning disabilities and behavioral disorders such as ADHD. Now, while this communication was a surprise to most physicians, it is based on both animal and human studies looking at the effect of these drugs on the human brain. Now, while more studies are currently underway and we expect the results soon, results that will likely add a great deal of clarity to these risks, there is enough information already that most of us feel that families of kids undergoing surgery should be informed. The real question is how to go about informing these families in a reasonable way without scaring them about these risks, and perhaps which patient populations should be targeted. Now, Derderian and colleagues reference a study from Texas Children's Hospital, my institution, that shows that only 10% of cases in children less than 3 years of age are greater than 3 hours in length, and 2/3 of those cases are corrective heart surgeries that certainly we would not put off based upon this warning. It's also important to remember that there are many other patients who are not undergoing surgery who also are exposed to these very same sedation drugs. At Texas Children's Hospital, it's estimated that there are over 6,000 MRIs done under sedation, with 36% of those being done in children less than 3 years of age, with an average duration of anesthesia of an hour and a half. And there's an entire population of ICU patients less than 3 years of age that are also given these drugs, sometimes for days, weeks, or even months. But if we're going to focus just on the surgical patient population, what should we tell these families as the information is so confusing even to the providers? So here at TCH, what we recommend our surgeons tell the patients is that based on all available studies, a single short duration anesthetic is safe in children. Repeated anesthetics or anesthetics greater than 3 hours may risk a slightly higher risk of ADHD or behavioral or learning disorders. Now, as Derderian and his colleagues recommend, purely elective procedures, if at all possible, should be delayed until the child is greater than 3 years of age. In patients where there is a concern that a delay that long will result in a suboptimal outcome, if at all possible, we recommend that the parents delay the surgery until greater than a year of age, as the risk seems to be greater in this very young patient population. The authors also point out that it's important to remember that anything we can do to minimize the dosage of anesthetic that children are getting probably helps as well. And this would include things such as regional blockades using topical or local anesthetic.